Welcome, everyone. We'll get started around 6:05. We'll get started very soon. So while we're waiting, we have our question of the day, and this one's kind of weird, but what is your favorite waiting room movie that you watch? Feel free to answer in the chat or say hi. Welcome to everyone joining us. We'll get started around 6:05. Feel free to answer the question in the chat or introduce yourself.
Hey, Coach Avar. Maybe that's for the best, Coach.
Welcome to everyone joining us. We'll get started at 6:05. Feel free to introduce yourself in the chat or answer the question of the day.
All right, everybody, let's get started. So welcome Alliance HOSA members to our February guest speaker event. Good evening, I'm Mansa Prasad, and just to introduce myself, I'm the Secretary of Alliance HOSA, and I am so excited to be here tonight with Mr. Gibbs.
Hey, everybody.
Hi, everyone. I'm Aditi, and I'm part of the Sophomore Council. And again, I'm so eager to get excited with tonight. So let's get started.
So tonight's guest speaker, as you can see, is Mr. Gibbs, a pediatric nurse and former paramedic. Fun fact for all our Alliance kids out there, Mr. Gibbs has worked before with Coach in the EMT field.
That's pretty cool. So Mr. Gibbs, if you could say a few words about yourself and your profession to our audience.
Yes, my name is Michael Gibbs, and I'm currently a registered nurse with Children's Healthcare of Atlanta, which is really the only pediatric hospital system in Atlanta. And I work at the Eggleston campus, which is across from Emory University, in the post-anesthesia care unit or the recovery room for after procedures.
Awesome. Again, like I said, we're so honored to be here tonight with you, and we're really excited. Let's begin. I think it's best to kind of backtrack and start from the beginning of it all. So as you may know, most of our students that are watching live right now are high schoolers. So let's start our conversation from there. Did you have your mindset into pediatrics when you were a high schooler? What was your high school journey like?
No, pediatrics was not on my mind, and neither was nursing at the time. I guess I was about 16 or 17, and I was in gymnastics. I was a gymnast, and I didn't know what I wanted to do. I come from a fortunate background where college was always a possibility for me that we had the finances for, but I was looking at maybe getting a business degree. Didn't really have any clear direction. I always had an interest in firefighting, and my gymnastics coach was a firefighter. And it just never really made sense to go to college, then to backtrack. Backtrack's not the right way of saying it, but then transition to firefighting. So with some direction from him, it all clicked for me to not go to college straight out of high school and to pursue firefighting and just see what would happen from there.
Okay, so can you talk about more about that transition, like your time as a firefighter?
Yeah, absolutely. So the initial thought was become a firefighter and see how that goes from there. The problem that came up was in 2008, the market completely crashed, which is when I graduated high school. So most fire departments went on hiring freezes. So to see if it was something that I was passionate about, I became a volunteer firefighter at first. And I completely fell in love with it from there. You only have to be 18 years old to be a firefighter, graduate from high school or a GED. So volunteered, and then after about a year, offered to go through the application process. Going from high school directly into a fire department was a transition of sorts. A lot of responsibility that happened. I was still living at home at the time and just saving up some money, which was a blessing. And then at Clayton County, where I worked, immediately after graduating fire academy, you had to start EMT school. It was in our contract to become EMTs. After completing EMT, then I went through the paramedic program immediately after that. Let's see, the whole process took about 2 years, I guess, give or take. And they've changed some things around now with EMT and paramedic. After that, I was pretty set. I was 21 years old, in charge of an ambulance as a paramedic in charge, which was, again, pretty eye-opening. It's a lot of responsibility, but I had some great mentors that educated me along the way. After that time period, I was getting comfortable being a paramedic, seeing a lot of emergencies, fighting fire as well. And I realized I wasn't very proficient with pediatrics. I liked kids, but we didn't run as many calls on kids. So I decided to start working part-time at Eggleston in their trauma center, which really opened my eyes to pediatrics from there. Fell in love with working with kids so much more than adults. And it was at that time that I realized I wanted to pursue a career in nursing.
Yeah.
So,
Sorry,
I'm
go
sorry, go
ahead.
ahead.
I said what I really find fascinating is how you can start off with an EMS foundation and then go on into nursing or pediatrics or really any other medical fields. So at our school, we actually have an EMS pathway. So it definitely lays out that good foundation. And to create a bridge between the two, could you tell us how paramedic helps you right now with being a pediatric nurse?
Absolutely. Hey, first off, that is so exciting that you guys have that resource available to you. EMS sets such a foundation for everything else. It's absolutely not a requirement. If anyone knows they want to be a nurse, you don't have to go the pathway that I did. It's not what I knew that I wanted with nursing initially, but EMS, you see a little bit of everything. And it teaches you critical thinking skills, independence, autonomy. And then you get to just see a variety of hospitals, emergency rooms, and kind of starts leading you in a direction that things that you may know that you want and what you don't. For example, I delivered 2 babies in my time that I was a paramedic. I don't particularly want to be a labor and delivery nurse now. I was happy to do it at the time, but you just start to realize things that you enjoy and that you don't. Once I made the decision to go to nursing school, I actually switched. I left the fire department and I worked full-time on the critical care transport team with Children's Healthcare of Atlanta. And that's where it was myself, a nurse, respiratory therapist, and an EMT. And we would go around the state of Georgia picking up kids that needed to come back to that specialty unit. That further helped me see the nurse's role in it and what I could bring in as a paramedic as I was going through my associate's degree program in nursing. But really where the paramedic shone the most, I think, is out of nursing school, I actually started working in an adult intensive care unit for 2 years. And that was prior to coming back to pediatrics. And seeing the emergent side of things, airway management, respiratory compromise. In the intensive care unit, you have some very high acuity patients. Being able to act quickly, just having that speed of thinking was so beneficial that I don't believe I would have had without my paramedic background. Sorry, did you have a question?
Yes. For making that transition, did it come kind of naturally? Like you knew that was what you wanted to do to transition your career?
Yes. So as a paramedic, you don't necessarily have a wide variety of options going forth in the future. Now, that is changing. But when I was there, you're either going to be at a fire department, which is a career pathway. You can get promoted, move up the chain. You can work in an emergency room. There's cath lab positions. You can teach paramedic school, or you can go like a flight route if you want to be a flight paramedic. But besides that, I'm sure there's other options out there, but there isn't a ton of options. And I realized I had such more of a passion for medicine than I did for fighting fire. Firefighting was a lot of fun and I enjoyed my time there, but nursing was going to open up a lot more doors for me of possibilities moving forward. So once I realized my passion was beyond the realm of emergency medical services, then yes, that transition, it was the next logical step for me. And at the time, I knew I couldn't stop working and go back to school. I was married, homeowner, where it didn't make a lot of sense to try to completely reset, and nursing was such a logical pathway to go for.
So how did you balance all this, like your nursing school, your current like job, what you're doing, and your like personal life at this time?
It kind of sucked, if I'm honest with you. It was difficult, but it wasn't impossible by any means. It started off slow of find a college and start taking a couple of core classes. And I just went at it bit by bit. For me, I was still working full time. Technically, I had 2 jobs when I started school, and then I dropped down to the one when I was on the transport team. It was just finding a workload that worked for me and not rushing anything. And once I adjusted to that, and made it so much easier, just taking off bites that I could chew, a couple of classes here, a couple of classes there. And then working one job was, of course, far better than 2. But it is a difficult time to be working full time in school and have a personal life, home life. But it's been so worth it now. And for me, I did an associate's degree program first, and they had a bridge program for paramedics and LPNs to transition to RN. I just worked on the core classes, and then that program was a little bit over a year, and that was just hunker down and get through it. But after that, at the end of the day, it was, I think, 2.5 years of school. I never took a semester off, but I just kind of worked my way through it. And then immediately after graduating, I started on my bachelor's at that time. And that was another 1.5 years after that.
If you could you give some advice for high schoolers who want to pursue pediatrics or the EMT field in the future?
Absolutely. I'll speak on EMS first. The advice that I would give is, if you think that you want to go into healthcare, but you don't know if you want to fully commit to a 4-year nursing program or getting a biology degree and then going from there into whether it's you're trying to do pre-med or physician's assistant, if you're unsure, EMS is such a good route to start with that really does not cost all that much money considering, and you have pretty good job security coming out from there, where you can start working, start seeing, and even if you decide after that that maybe medicine's not something you want to pursue, you won't have invested too much time or money into it. But also for whatever you want to do after that, whether it's nursing or become a physician's assistant, go pre-med, it's just going to look great on your resume to have that experience, and you'll learn a lot about yourself there. Fire departments are also amazing resources for this. They are typically pretty competitive to get on with, but the combination of the firefighting, rescue, and EMS, because for example, where I worked, we had our own ambulances. So I spent most of my time on the ambulance. And then every now and then I would be on the fire engine. But you got to see both worlds and then see a leadership, a paramilitary organization that was super beneficial to me, where my advice of getting into it is, if you want to do a fire department and you're having trouble getting on, go to EMT school. Then they don't have to spend the money to put you through EMT school, but then they also don't have to pay you while you're going through it. Where some technical colleges will offer like firefighting certifications, and those are great. But if you really want to be a competitive applicant at a fire department, if you go ahead and get your EMT, it's going to look a lot better, and it's going to save them money, which is going to make you more attractive to them. For pediatric side of things, or for the adult critical care time that I did, if you think that you want to do pediatrics, and from a nursing perspective, that is one of the beauties of nursing school. When you go through clinicals, you will get to experience pediatric locations and see if it is an interest. And then a lot of schools offer like a senior practicum that you can do, where most of your clinical time is in a unit of your interest. So for example, maybe a pediatric intensive care unit or a regular pediatric medical surgical floor, and you can pursue that. If you decide to do that route, that also makes you more attractive if you want to go straight into pediatrics out of school, where you've already shown that interest and that dedication to pediatrics.
Awesome. So kind of related, we have a question from one of our members, Ifa. I'll read it. You mentioned you were married and had a home life. So, did your choice to pursue nursing affect your relationships, and how did your family feel about switching careers?
That's a great question. So when my wife and I started dating, I was already at the fire department. And then I just got my paramedic right before we got married. So she was very used to the firefighting schedule, which is you're gone every third day for 24 hours at a time. So she was used to being flexible with schedule and workload, and then working the two jobs. She was all for the transition into nursing, especially when I wouldn't be gone every third day. Financially, I could work one job instead of two. So she was very encouraging of it. And I should preface, we don't have any kids right now, which would kind of throw a completely different element into it. But it did, of course, put pressure on the relationship, but really just made us stronger. I feel like she has a bachelor's degree in nursing as well as I do at this point. She helped me study, proofread all my papers. So we were able to turn it into something that we could go through together to strengthen it. But of course, anytime that you're working full time and your spouse is working full time and you decide to add school onto it, it is a stress, but it's not permanent. And the benefit now, we've been so much happier since then that it's been completely worth it.
That's really important to make sure we have that balance in life. Rashima, one of our other members, asks, could you describe what a typical day at work is like for you?
Yes. And I'm going to assume that we're talking about in my current role now in the post-anesthesia care unit, or the PACU. So in the PACU, as soon as the surgery is done, a kid is brought out to us. Typically, they're still completely asleep from their surgery. I have one patient at a time, and the main goal initially is to make sure that that patient will transition into an awake stage safely and stably. It can be some airway management. Sometimes we have to assist in helping these kids breathe, and then also monitoring their vital signs, of course. Typically, their blood pressure is low, their heart rate's up, whether it's giving them some IV fluids or medications. And then once we begin to wake them up, the big issue is typically pain. How do we ensure that these kids are nice and comfortable? And that's going to vary from, we do a lot of like tonsillectomies, of having your tonsils taken out. That's on one side of it, where it's pain medicine and popsicles. And then we also deal with congenital heart defect patients, or even kidney transplant patients, for example, because Eggleston's a transplant center. And you'll have a patient who just got a fresh kidney, and we are the first step of ensuring that that kidney has the blood flow that it needs, that it starts making the urine, all the vital signs are okay, getting immediate ultrasounds and x-rays. So it can be quite a bit at once. And then as soon as a kid is awake and their pain's under control, then it's time to get them essentially back to their parents, or whether it's back up to a room in the intensive care unit, to a regular floor, or if it's that tonsillectomy, just getting them back to our ambulatory center to then eventually go home that day.
Awesome. With all of these like procedures and how many patients you see a day, like what consists of your team? Like who's on your team, and like how does that
we are the majority of all of us are nurses in the PACU. We do have respiratory therapists on standby as well to assist. And then the main group of physicians that we function under is the anesthesiologist. So those are the doctors, of course, being in charge of making sure these patients are put to sleep, stay asleep. They work with anesthetists, which are either like a physician's assistant or a certified registered nurse anesthetist. They're the ones that are with that patient the entire time through the procedure, administering the anesthesia. But if they come out to me, the doctors that are writing me the orders are the anesthesiologist. And then we also work in conjunction with the surgeons that perform the surgery. So whether it's they're fixing a broken leg, we're going to see what the surgeon wants with that leg specifically. And then for the wake up pain process, I'm dealing directly with our anesthesiologist. And if an emergency does arise, we would notify an anesthesia now, where we get the entire anesthesia team that comes to bedside to assist.
Wow, that's a pretty large team. I think teamwork definitely makes the dream work.
Yes, nothing,
Yeah.
nothing in healthcare is accomplished by yourself. That is for sure.
Another member, Sonia Prabhakar, asks, what was the most difficult or stressful situation you've encountered being a pediatric nurse?
That is a really good question. So specifically for a pediatric nurse side of things, sometimes after anesthesia, especially smaller children will have a side effect, because when they come out, they can breathe on their own, but they're pretty much still kind of unresponsive. And as they're starting to regain those reflexes and the feeling, they can have some weird respiratory issues happen, where they can laryngospasm up here and the vocal cords kind of clamp shut. And with that, they're no longer breathing, which is a relatively terrifying and concerning time. And it's not always so easy to be able to kind of pop those vocal cords back open, where sometimes anesthesia has to come out and resedate those children to get them relaxed. And sometimes they have to have a breathing tube placed back in temporarily. But as a pediatric nurse, that would probably be in the realm of difficult and stressful. When I was a medic on the transport team, there was a huge variety of issues that you dealt with, of sometimes having to put in the breathing tubes because these kids just tire out if they have asthma bad enough, or some congenital heart defects where their hearts got stuffed every wrong possible way. Those can become pretty high acute situations, and so you're doing everything possible to make sure that that heart keeps beating.
Kind of a related question, but how do you manage your stress, like in the workplace?
That is an excellent question as well. I would say it's probably better in nursing than it was in EMS, which is not to insult EMS. EMS is working. I think the industry is changing a lot, where there's starting to be a lot more resources out there. For me in the hospitals, first off, your coworkers are the best thing possible. To have good working relationships and be open and honest with discussing when something bothers you, that something doesn't sit well with you. There's also resources of employee assistance programs. We have, for example, at Children's, we have a chaplain who's just for staff members. They don't do interactions with patients or families. They're just there for us. And if we need to do a debriefing after a stressful event, they are there to be our resource for us. For me as well, a big thing is my home life and just general health and well-being as well, of doing an exercise regimen. I have discussions with my wife. Every relationship is different for everyone. I don't always tell her all the details, but that's not really important. She just needs to know that maybe something bothered me that day, and to kind of help me process and get through it. Of friends, family, spirituality, if that's something that you believe in, and then just general well-being, all makes it so much easier to deal with. But it is healthcare. There's bad days, and that sometimes just takes time.
Yeah, and especially because of the pandemic, healthcare providers all around the globe do feel overworked and really stressed out. So how has COVID affected your profession?
So for me, the last night that I worked in the intensive care unit was the first COVID positive patient that we admitted at the hospital that I worked. And I took care of that patient that night, who was relatively stable. That was March of last year, and we weren't ready as healthcare in general. We weren't prepared for what was coming. Now, the hospital that I was at, we had some systems in place, but not a lot of time for formal training. It hit a lot faster. And then shortly after that, I transitioned to the PACU where I work now, and they stopped all elective surgeries. So the caseload, instead of maybe 60 surgeries a day, went down to like 8. So then there was, of course, the risk of, are you still going to be able to stay on? Do they need to cut staff? So COVID threw an interesting element of needing a lot of nurses in an intensive care and inpatient setting, but all the other aspects of nursing were being looked at as maybe they need to get cut. So it was a pretty concerning time, and I have some friends and coworkers that did lose their positions. They got rehired in other positions now. And then for my coworkers back in the intensive care unit, incredibly stressful. Burnout is a real thing. I kind of considered that I was fortunate to get out in some ways when I did, but part of me also wishes I was there with my friends and going through it together. But one of them had an incident where I think 4 patients had died in the same room within like a 48-hour period, and all of it was COVID related. So it's real. Things were incredibly bad and overwhelmed, but I'm hopeful now. The vaccine's out. I've been vaccinated. I'm hoping that we will start to get ahead of this and take this as a learning opportunity, because there is other viruses out there. There will be another one, and hopefully we can learn as this just worldwide as a nation, healthcare system, and be better prepared and support the stress side of it for our staff.
So we have another question from one of our members. Is dealing with children patients any different from an adult when seeing someone go through a health problem or procedure?
Yes. Depending on the age. So at Children's Healthcare, we deal with anyone from a newborn, so 0 days old, to technically we accept like 21 years old. So of course, on the adolescent side and the young adult side, there's not necessarily as big of differences there. But an easy example, in the adult world, someone needs an IV. You walk in and you say, I need to do an IV, and they hold out their arm and you just do your IV and you go about your day. Now try to explain to a 4-year-old that I'm going to jab a needle into your arm, and it's going to make you better, but for right now, it's not going to feel so good. The approach becomes entirely different. The beauty of kids is they're so resilient. When you see these kids with chronic illnesses, cancer, things like that, it is difficult to see, but they will push through and just tough it out so much of the time. You can also, they easily forget things, and they can be screaming at you 1 second, and then next second they're eating a popsicle and you're watching Paw Patrol together. Adults are the complete opposite of that. There is a lot more simplicity with adults, of course. You can just talk as I'm talking to you guys. But with that also, the reward factor is different. And kind of as I said earlier, everyone will find their own thing that they're interested in. While I think I'm pretty capable of most aspects of healthcare, there's things I'm not overly interested in, like labor and delivery or burn unit, or there's nurses that get up every day and they just look at wounds. That's their entire job, wound care nursing. Not for me, but to each their own. Where pediatrics maybe isn't necessarily what everyone wants to do. I will say, on a good day in pediatrics, helping save the life of a child or a procedure to go well is, to me, so much more rewarding than any experience I had with an adult. The downside is the bad days in pediatrics, when a kid unfortunately does not make it, does not pull through, is so much more difficult to observe than an adult, because this may sound cold, but it's different dealing with a 90-year-old who's lived a full life, has bukus of grandchildren, and maybe they have cancer, and now you transition to how do I make sure that they're comfortable and pass peacefully. That's a beautiful thing too, but that's not as challenging for me personally versus when it's a 9-year-old that is dying of cancer. If that answered the question.
I know we touched on this a little bit, but Tanvita asked, what advice would you give a high schooler pursuing medicine? So in general, medicine instead of just EMS.
All right. So for medicine in general, for your time in high school, the big things that I would encourage is do well with science, any sciences you can take, whether it's biology, microbiology, and I'm sure you guys are tired of hearing do well in school, but anything science related, but also your ability to write is crucial. So all the papers, everything else, no matter what you do in your medical pursuits, that is going to become such a huge thing. These are typically competitive programs, and how you communicate, whether it's through written or verbal, matters a lot. And it is, if you go into nursing, or if you want to go pre-med, become a doctor, or as I said earlier, like a physician's assistant, your ability to write and perform well at those sciences are the number one thing that's really looked at from everything that I've observed. So I would say do that as much as you can. And then there is also, I don't know for your guys' school, but I helped some high school students introduce them to the ICU at the previous job that I worked at, where come do a rotation. It's going to look extra good on your resume that you've started a process, whether that be for nursing or anything else you want to do, of get in there and see if you like it and see if that's an option for you. And that'll just build you. It shows that you're willing to go above your basic duties and go on.
Yeah, our county has like a mentorship program in place, which does give a lot of our high schoolers experience in different fields of medicine. And I think it's like super important. Kind of related, but what do you think are some important qualities of like being a good health professional?
That's I would say there's a few. The go-to cliche is be compassionate, which it's there for a reason, because that truly is the most, I would argue, important thing. Is you don't always have to put yourself in someone else's shoes. That's not the goal. It's to recognize what someone is going through. It's empathy instead of sympathy, where sympathy, I've been there, I know what's going on. Empathy is more just that recognition of what someone else is going through. Of, I don't have asthma, I've never had an asthma attack, I'm never going to be sympathetic to that, but I can empathize, and with my understanding and knowledge, and try to help, and realize that for the most part in medicine, people are not having a good day when they see you if you're in a hospital. Now, maybe it's a scheduled surgery or something, but that compassion is very important. And with that, you'll figure out, navigate your own levels and abilities of how much you're comfortable feeling and not. But just realizing that that patient is truly a human being. And the further most people get medicine, myself included, sometimes we start to forget that they're people and they're just patients. We see that with doctors a lot as well, but of just remembering that compassionate element. And then if you are a critical thinker and you're confident, these matter, because there's times that you will have to advocate for your patient, and you have to be able to articulate why and think faster on your feet, because sometimes doctors miss things, and you're the next line there of that early recognition. And again, it kind of goes back to being able to articulate and verbally communicate well, so you can actually advocate for your patient.
Absolutely. And in pediatrics, I feel like the field is just so much fun because it's just kids. And so what's your favorite thing about pediatrics?
Gee, that's a tough question. Because the obvious answer is kids, but
Yep.
I guess kind of what I touched on earlier is the resilience of kids. It's admirable, and it makes you realize that sometimes the things that you perceive as big problems really aren't, and the way that they view the world is just it's encouraging and inspiring, where making a kid feel good, even if it's a simple tonsil procedure, which is not the most emergent thing in the world, but if I can have them smiling, chewing on a popsicle when I take them back over to their parents, that's rewarding to me. And then on this more critical side, when I can take that patient that just got a kidney finally up to the intensive care unit and they're making great urine and all their vital signs look great, and I've been that bridge and updated the parents as well, it's all of those things are rewarding. Just the general vibe at a pediatric hospital is completely different than an adult hospital. It's bright, it's happy, it's upbeat, and it's just, to me, it's a better place to work.
Okay, so Sakshi asked, how do you deal with kids who are very resistant to care, like the ones who scream and try to run?
Oh no.
Yeah. So there's multiple approaches to that, and a lot of it's going to be dependent on how sick are these patients. And again, what I do, I've never worked in just a doctor's office where just giving an immunization or a flu vaccine or something. So I'm sure they have a different approach. For us, we try to incorporate and get knowledge from parents as much as possible. There's also a position at Children's called a child life specialist, which is really a kid advocate. And they go in and they have the education, the tools, and the resources to navigate what's best for that kid and how do we adjust things to make it better. An easy example is we deal with a lot of autistic children. These are not necessarily perceiving things the way that we do, where that child life specialist can go in and make a plan where it may be as simple as this patient doesn't want to wear a gown and wants their favorite t-shirt on, and they want their armband on their feet, not on their hands, and they want that IV covered up at all times. These are really simple things that we can do and adjust our standard procedure with to try to facilitate what's best for the kid. In the post-anesthesia care unit, my goal is as soon as that patient is starting to wake up a little bit, get them back to their parents as fast as possible, because they're still sleepy and groggy. And the best thing is to have that parental presence there to help facilitate that wake up. Unfortunately, some severely autistic kids are just not happy to be at the hospital, and you do everything that you can to make it as least painful as possible, but that always just doesn't feel like a win necessarily. But again, parent involvement is huge.
Another question that we have is from Shreya, and she asks, how has medicine evolved since you began in pediatric or EMS?
Good question. So again, going back, it was about 2008 when I joined the fire department initially. From a hospital side of things and performance, we saw like Obamacare come into the equation, insurance changed. That has made a lot of adjustments to the operations of hospitals. From my time in EMS to now, and then from working in the hospital part-time for part of that, a big emphasis now is on charting, and a lot of it's just electronic and how it's billed with insurance or Medicare or Medicaid. And from that side of things, honestly, it's a little bit frustrating because it kind of is steering the focus away from the patient care and making sure that everything is charted appropriately. I'm optimistic there is some pushback happening there of trying to find that balance of course, we want to make sure that what we do is charted appropriately, but we also don't want to be so worried about the chart that we forget and we miss something with the patient. That's evolving slowly, but again, I'm optimistic. From the EMS side of things, EMS is evolving. The EMT program changed even since I was in it. Used to be EMT intermediate, now they're advanced EMTs, capable of doing more things. A lot of EMS agencies are taking on more responsibilities and having more equipment readily available. An easy example is Grady now has a mobile stroke unit, where they will respond to a stroke call. They have a CT scanner in this ambulance, can do a CT scan and administer a clot busting medicine before they're even in the hospital. So things like that, of that early onset, is very exciting. Some departments are starting community medicine programs where a unit may go out and help make sure that someone who doesn't have transportation has the appropriate prescriptions that they need, that they're taking everything as they need to. So EMS is evolving beyond just responding to those 911 calls, and you're seeing a lot more aspects of medicine, which I think is exciting.
With all these changes, it's like a process to navigate. So going back, did you have any mentors that helped you, like going from EMT to a pediatric like position?
I had a lot of mentors along the way. I was very fortunate at the fire department to have a lot of paramedics and EMTs, just various people to look up to. I knew a lot of EMTs that were better than most paramedics. They just never went to paramedic school. Knowledge is there for everyone. And I had some amazing coworkers, and I talked to them about my strengths, my weaknesses, what I thought I wanted to do. And they were encouraging or would shoot me down when something wasn't a good idea. It's having those honest mentors. Of course, I met Coach Avar at Clayton County as well. We were never at the same station, but we were on the same shift and ran some good calls with her. But I had a couple of paramedic instructors that early on were encouraging me to go beyond just paramedic, that they saw something in me, and that matters, that over time helped. And then I had coworkers that went to nursing school with me, and carpooling and studying for tests and being there together, we were all each other's mentor in some way because we all had different backgrounds. I brought some of the pediatric element. Someone else had worked more inpatient in a hospital, where we were there. And then, of course, my college professors, I'm not going to say all of them were mentors, but you find a few of them that you could truly talk to and tell about your plans. And they would sometimes adjust their curriculum to try to help me succeed in what I was doing. And all of that became so important to then start nursing. And then it was my first ICU preceptors teaching me how to transition from being a paramedic and from pediatrics to welcome back to the adult world and into an intensive care environment.
Okay, we have one more member question. She asks, have you ever experienced a situation with kids where you didn't exactly know how to react?
Yes, and I would say that also applies to adults or any type of patient. Is there's a lot of situations where you don't know how to react. In EMS, the beauty that you're taught, it's a simplistic algorithm, and I'm sure you guys have heard about it, but of your ABCs, your airway, breathing, circulation. At the time when I was on an ambulance in the fire department, I had an EKG machine, a blood pressure cuff, a pulse ox, a glucometer, and a stethoscope. Use those couple of tools to try to figure out the answer to the problem, and it doesn't work. But they can lend you in the right direction of, if when in doubt, if I didn't know what to do. And there's plenty of times when I would call into a hospital and say, I have no idea what's going on. But what I do know is, here's how he's breathing, here's how many times, here's what his blood pressure is. And I'm going to support all those things and get him to you as fast as possible. And then they're going to be your problem. So there is always times in healthcare where do what's right for the patient as much as you can and toss it up to someone else. And if that's that you're nursing and something's not going right, you don't know what's going on, that's where you call the doctor. And if they give pushback, you push back on them. That's where that advocacy comes in of, absolutely, there's a million times that I haven't known what to do. When I was on the pediatric critical care transport team, we were really fortunate. At any point, I could get on the phone with one of our ICU doctors and explain what was going on. Once it got above my knowledge base, and maybe it's just I didn't have the way to test for it talking to them and figuring out what's best to do was such a huge benefit. But over time and experience, you start to kind of gauge what you can handle and what you can't.
Right. Teamwork is really important, especially to have someone to have you have your back. It's just really important. Another question that we have is, how do you deal with stressed parents questioning everything and wanting the best for their child?
That is in the element of one of the really challenging things of working in pediatrics, because ultimately in adults, of course, you incorporate family members. If you have someone who you've put into kind of a coma on a ventilator, obviously that patient can't speak for themselves, so you're incorporating other family members into decision making. That's a little easier when it's another adult to an adult. The pediatric side is the challenge because these parents feel out of control, essentially, in a lot of ways. They want what's best for their child, and typically they are the go-to person for what's best. And now we're taking some of that from them, and they don't understand what's going on, where you do get the parents, as described in the question, that every little decision is a question. It may even be why you picked apple juice over Powerade for the kid to drink. It's just, I would argue, their way of trying to have control and feeling lost. And the best thing there is just patience, of just staying calm and navigating and setting. At some point, it is hard that you do have to set boundaries of, no, we're not doing that because that's not medically appropriate. But here is what I can try to do as well, of trying to always do a little bit of a give and take with them. But it's a high stress thing when you're trying to focus on this kid who's sick and they need most of your attention. And then it almost feels like you have 2 or 3 patients total once you have a mom and a dad and a patient. Ultimately, focus on that kid. And that, in my experience, when I've had to play this card, it's not always received well, but it's respected when I tell parents, look, I want to keep you informed and you have every right to know what's going on with your child. However, right now, there is a list of things that I have to get done to make sure that your kid's taken care of appropriately. Again, they're going to be concerned when they hear that, but most of the time, when you talk to them clearly and keep them informed to some degree, they will respect it.
No, she's on mute. I'll go ahead and say, what's one of the most interesting or eventful opportunities that you worked on as a pediatric nurse?
That's a good question. Kind of think on that of with how children's works, there we have multiple committees and councils that nurses can be on to try to help facilitate change, and that allows nurses to, whether it's again parent relations or technology components of it, or just things to make your work life better, of retention and relaxation. There's a lot of opportunities there as a nurse that you can pursue to try to help everyone out. For me personally, I don't know if I have an example in the PACU that I currently work of a very interesting opportunity, to be honest with you. Back on my critical care transport days, the children's ambulances, we also had a helicopter, which you guys may have seen flying over Atlanta at some point. And I was just getting ready to graduate nursing school, unfortunately, but a position opened up to be a flight paramedic on that. And that probably would have been one of the more interesting opportunities to specialize in pediatrics that I could have done. But nursing took that over, which maybe one day I'll go back to that transport team as a nurse and see if I can't be a flight nurse for them or something.
We have some of our last questions. We're going to be wrapping up our Q&A session soon, so please feel free to ask any remaining questions. But for now, we have a question from one of our members, Sonia, and she asked, could you describe how clinical rotations helped in shaping your nursing career?
Yes. I will preface this that on the nursing side of it, for my associate's degree, again, I went to a bridge program, which had a reduced number of clinical hours needed because everyone in it was already a paramedic or an LPN. So it was based on the assumption that you already had medical experience prior to. So I didn't necessarily do as many clinicals and already had a little bit of an idea of what I wanted to do. The clinicals I did as a EMT and paramedic student were highly beneficial of seeing that emergency room and seeing it from the opposite side of where does care continue from here. We also had to do labor and delivery rotations, ICU rotations, and those were very beneficial in helping me in EMS. On the nursing side of it, just spending the time, what really helped me was I knew that I wanted to do ICU out of nursing school. It was going to be a big resume builder for me. I was going to use that to merge my previous emergent experience. But seeing the other sides of the hospital, even just like a regular medical surgical floor, and seeing what some of these nurses deal with when they have 6 patients and there's 6 people wanting them all at once, that gave me such a different appreciation of what they go through. It also cemented that I did not want to do that at all. But then once I started working in the intensive care unit, we were a part of the code team that responded to those floors. And it gave me an entirely different appreciation of if that nurse didn't know something, it's because they have 6 patients that they're juggling. And I've seen that firsthand. Or if we go to labor and delivery for a mom that's crashing, seeing that they're trying to juggle this newborn kid and keeping them alive, doing well, and helping the mom, it gives you a very good perspective on what all the other moving pieces are, and then help shape exactly what you want to do. And with nursing, you can change your mind every few years. Again, I did adult intensive care unit, and now I'm pediatric PACU. 3 years from now, I may be pediatric intensive care. I don't know. And that's the beauty of it. It keeps it open.
Give me a second. Okay, so we have a question from one of our members, and she asks, which location of Children's are you mainly stationed at?
So currently I'm mainly at Eggleston, which is in Decatur across from Emory University and Emory Hospital. When I was on the transport team, we started out of Scottish Rite Hospital, which is on the north side. There is a third hospital with children's called Hugh Spalding, which is downtown next to Grady. But it, for example, doesn't have intensive care units or operating rooms. It's primarily an emergency room with a medical surgical floor. But primarily I'm at Eggleston currently.
All right, and our last question of the night is from Mehul. He asks, what is one of the biggest things you've learned that can be applied to any career?
Ooh, man, hitting big for the last question. Honestly, professional interaction, whether that be with coworkers, supervisors, patients, subordinates, figuring out how to handle people is the most challenging aspect, but it's also been something that I would argue you can use no matter where you go of how do you handle confrontation? How do you handle praise, and how do you dispense that to others, and navigating so many things are just simply miscommunicated that get taken to someone's offended by, and of just how to navigate that interaction is probably been one of the most beneficial things, because a lot of times I'm kind of having to act and navigate between doctors, fellow nurses, techs, parents, the actual patient, where I'm going from talking on a doctor level to then to a 4-year-old, now over here to the parent, and then to my fellow coworker of just how to constantly adapt to that. I know that's not a very fancy answer, but that's probably been one of the most critical things for me.
Well, excellent. That ends our Q&A for the night. First off, I'd like to thank you so much, Mr. Gibbs, for your time. And you've definitely, most definitely inspired a lot of our students on the live tonight because of all of your wise words. And we were so happy to have you.
Thank you so much for the opportunity. I'm more than happy to share what I know. And if anyone has any follow-up questions or anything, you guys have my information. Please feel free to reach out. This doesn't have to be the end of it. I'm happy to continue to share what I know.
Yes,
And
thank you.
if any of our members do have questions, just contact me and Monis and we can pass it on. Next, we're gonna leave the QR code for attendance for 30 seconds, so be sure to scan. This video will be posted soon on our YouTube channel. The form will close on Friday, February 26th. Thank you guys and have a great night. And yes, Coach says thank you.
Thank you, Coach, and thank you all for listening. I really appreciate your time.
And good night.
Good night.